So the IMPHS project was a project where we were trying to understand the physical health needs of people with severe mental illness in South London.
What has it meant to you to be involved in the IMPHS project?
It's a lot. As a child, no one knowing what was wrong with me, getting passed from pillar to post. And it was only in my adult years that South London and Maudsley discovered my illness and made my life a lot more easier. It ruined a lot of my childhood because of no one knowing what was wrong. And not just that, I think most people just didn't care. I lost everything over it. I'm a qualified electrical engineer. I lost my driver's licence, I lost my job. It just ruined, took everything. And I had this extremely acrimonious view at one point of life, thinking like, why me and all that. And I've just done a complete 360, and now I feel like my life is in a really good place. And coming like with IMPHS and working on projects with IMPHS, it enables me to give back, and that's what it's all about, you know, with my time. And it's really important that I keep active, and I can with IMPHS. It took me out of a really dark place, getting to realise there's more people like myself that actually care, because at one point I didn't think anybody cared, and it sort of like restored my faith in humanity, like just seeing so many people that care, and that's what made me even more interested.
What difference did it make having experts?
Having experts involved in IMPHS was invaluable. We couldn't have delivered that project without them.
It was a fantastic experience. I think it helped our project to thrive and succeed where it wouldn't have done otherwise.
Made a big difference having experts involved in IMPHS. I think on lots of different levels, you know, people can tell you their experience, what they've experienced when they're like accessing health services, how people have treated them, what that made them feel like. And then I think that really helps you to sort of stay grounded in what it is that you're trying to do. You know, it can get a bit abstract at times when you're thinking about trying to change things. And then I think when you've got people in the room with you who have got those experiences, then it's really helpful to help you to realise, what needs to happen and what's important to people.
So I'm a nurse and a clinician, and I had to go and speak to patients, so I had to go and speak to staff members, and I definitely know, like, I had something planned that I wanted to go and speak to people about, but on a few occasions the experts came with me, and they also helped to talk to patients and staff, and actually seeing the relationship kind of grow because of how the experts were able to use their experience in those conversations just gave us such a richness and quality of feedback that I don't think we would have got otherwise. And I can see that definitely from when I went to speak to one group of patients on a ward, and then the following week I went and spoke to another group of patients on a ward with an expert by experience, and the feedback that we got and the way people were able to communicate, it just showed me how important it really is to include people at all stages of the project.
The insights were, for us, an opportunity to really learn and educate ourselves as a clinical academic team, project team, to be able to think about how we could use that knowledge for greater effect and greater good. And because of the fact we had their support and their involvement, it felt collaborative. It felt that all of our work was open to critique by our experts. I think the overall difference that our experts made is really that they challenged us, they positively challenged us in every interaction. They made sure that they held us to account, and they made sure that we were really doing what we said we were going to do. So anything that we took on board by way of their advice, that we really used it. And that was a lovely, lovely part of delivering IMPHS.
Health is extremely important, so supporting improvements for physical and mental health is positive. I am happy and willing to contribute for change and/or adjustments for the majority to have good health, knowledge, available and or shared along with relevant choices to make the best informed decisions. I have no complaints with the IMPHS project. It has been refreshing and inspired hope with people. Each and everyone within the IMPHS project have been and are friendly, kind and respectful. I wish I had been involved with the IMPHS team sooner in life, so I would have known what I know now about happy and appreciative expert by experience working. My aim has never changed, so getting to this point within my public involvement is an important achievement.
I think being part of the team was useful for me because often I feel excluded because of symptoms of my diagnosis. The interest, the cognitive work, the professionals without stigma, important because often we receive so much stigma in our daily life.